Whoa! I never thought about that!
Today, we are going on a bit of an investigative journey into the mysterious, sometimes hilarious, and honestly often incredibly loud nighttime noises our bodies make. Think about it, we spend about a third of our entire lives asleep, and for a vast majority of us, that time is accompanied by a very specific, totally inescapable soundtrack. So we're going to break down the actual science of what's really happening when the lights go out. You know the sound. The heavy grumble, the whistling breath, the classic snore. Everyone has heard it. Sometimes it's kind of funny, right? But other times it is unbelievably loud and literally keeps the entire household awake. But have you ever stopped to actually wonder what causes it? Like, why do some people snore like a freight train while others are just completely silent? And more importantly, can science actually stop it? Okay, let's dive into this and uncover the weird science behind that nocturnal rumble.
Section 1. The anatomy of snoring. The physics of the rumble.
To really understand the noise, we have to figure out exactly what happens inside the human body when we drift off to sleep. Basically, snoring is, at its core, sound waves created by the vibration of soft tissues when air squeezes through a narrowed airway during sleep. You see, when you fall asleep, your body deeply relaxes. And we're not just talking about your arms and legs here. That relaxation actually includes the muscles in your throat, your tongue, and all the soft tissues in your mouth and airway. They just let go and loosen up completely.
Now compare normal breathing, where air moves smoothly in and out without any obstruction at all, to a narrowed airway. When the airway gets narrower, the air has to forcefully squeeze through that tight, super relaxed space. And this squeezing, it causes those loosened soft tissues to flutter. It's exactly the same physics as the wind flapping a loose flag on a flagpole, or air vibrating inside a musical instrument like a trumpet. Literally the same thing. That vibration creates sound waves, and those waves are exactly what we call snoring.
Moving on to Section 2. Who are the culprits? Identifying the vibrating tissues.
So who are the primary culprits behind all this vibration? Well, it's mostly the soft palate, the uvula, that little dangling part in the back of your throat, the base of the tongue, and your nasal tissues. What's actually fascinating here is that different people snore differently depending on which of these tissues is the main driver. So your snore might be a soft palate flutter, while someone else's might be entirely driven by their tongue relaxing just a little too far backward.
So why do these tissues get in the way for some of us and not others? Well, specific lifestyle and physical factors play a huge role in shrinking that airway. For instance, look at sleeping on your back. That just lets gravity pull the tongue backward, which blocks airflow. Extra weight, specifically fat around the neck area, can physically compress the airway from the outside. Then you've got nasal congestion from colds or allergies, which naturally narrows the breathing passages, meaning less space for airflow and way more vibration. And alcohol. Well, it deeply relaxes those throat muscles even more than normal sleep does, which severely increases the chances of a total collapse.
Now, you might be wondering, how do we know all this with such certainty? Modern sleep science caught these culprits right in the act. Doctors and scientists actually observe sleeping patients in highly specialized sleep labs. They use this whole array of advanced sensors to monitor breathing, track oxygen levels, measure airflow, and even record brain activity. And by doing this, they were able to directly link that airway tissue vibration to the snoring sound, basically creating a perfect map of how muscle relaxation leads to the noise.
Section 3. When it becomes dangerous. Crossing into sleep apnea.
Now, we need to talk about the stark difference between harmless snoring and sleep apnea. With harmless snoring, despite the ridiculously loud noise, oxygen is still getting to the lungs. But on the other side of the spectrum is sleep apnea. This is a condition where breathing actually briefly stops entirely during sleep. The airway completely collapses, totally blocking the air. Because of this, the brain basically has to hit the panic button. It constantly sends panic signals to partially wake the body up just to restart the breathing process.
And this is exactly why recognizing the indicators is absolutely crucial. If someone experiences sudden gasping during sleep or wakes up feeling completely drained despite being in bed for a full night, or just feels excessively sleepy all day long, well, these are serious red flags. These symptoms highlight exactly why untreated sleep apnea can become a very serious health issue. It severely disrupts your rest and deprives your body of the continuous oxygen it desperately needs to actually function.
Section 4. Silencing the nighttime instrument. Science-backed solutions.
Fortunately, we are not completely helpless against this nighttime rumble. We can actually directly target those root causes with some surprisingly effective adjustments. Sleeping on your side uses gravity to help keep the airway open, rather than letting the tongue fall back. Weight reduction actively reduces the physical pressure that's compressing the neck. Treating nasal congestion means better nasal breathing, which directly translates to less mouth breathing and, you guessed it, less vibration. And simply avoiding alcohol before sleep prevents that excessive, unnatural muscle relaxation in the throat.
Now, for those dealing with the more severe condition of sleep apnea, there is a highly specific medical intervention. Enter the CPAP machine. This is a device that gently pushes a continuous stream of air right into the airway to keep it continuously open. Commonly prescribed for severe sleep apnea, the CPAP physically prevents the airway from ever collapsing during the night. It ensures constant oxygen flow, essentially acting as an invisible splint for your throat. It's an absolute game changer.
All right, before we wrap up our investigation today, I have a truly mind-blowing fact for you. 90, as in 90 decibels. Scientists have actually recorded some snoring reaching over 90 decibels. To put that into perspective for a second, that is almost as loud as a revving motorcycle or standing right next to heavy rushing city traffic. It is absolutely incredible, and honestly a bit wild, what the relaxed human body is capable of producing entirely by accident.
Ultimately, snoring isn't just some random meaningless noise. It's an intricate combination of air, anatomy, muscle relaxation, and vibration physics all working together in the dark. So the next time you hear that nocturnal rumble coming from across the room, you really have to ask yourself, is the human throat just a strange, poorly tuned nighttime musical instrument waiting for an upgrade?
And that's just one tiny big question. Imagine what's next. Subscribe, and let's keep wondering.